Hello and welcome to Med Hustle with Rohan. Today I am going to start with a very important lecture that is on the fracture of clavicle. So this is the episode 1 of clinical anatomy series. It is a game changing series for your MBBS first prof because it will help you to memorize the concept more easily, because if you know the clinical importance of that topic, it is much easier to memorize that thing. Secondly, more importantly, it will make your habit to learn thing clinically. If you are getting if in subsequent year you will be dealing with patient, so the clinical study is very important. Now let me start from the fracture of clavicle. So in this session I will be first tell you about that how the fracture of clavicle will take place. Then I will tell you about if the patient will be having the clavicle fracture, what is the clinical. First, the clavicle. Let me introduce about the clavicle. You know, you have learnt in osteology, but I will tell you something about that. That clavicle is called a collar bone. It is a S-shaped bone, and what is the function of that? It will transmit the force of the limb toward the axial skeleton. So if there is a excess force transmission, then the fracture of clavicle take place. But have you ever noticed that this clavicle fracture will take place at the junction of medial 2/3 and the lateral 1/3? What do you think? What is the reason for that? I will discuss this first. So that's very important, that clavicle most often fractured at this side. The first reason, which is very important, anatomical position which is present here in our body, that the clavicle has curvature difference in at the medial 2/3 and the lateral 1/3. Anatomical position, the medial 2/3 of the clavicle is convex forward, while the lateral 1/3 of the clavicle is concave forward. So there is curvature change in the in at the junction of medial 2/3 and the lateral 1/3. Second is the shape, that is different. Shape change at this side, because the medial 2/3 of the clavicle is cylindrical in shape, while the lateral 1/3 is flattened. So if the shape is changing from the cylindrical to the uh, flattened, that's why we have the potential weak site at this. That the muscular attachment is not there at the junction of medial 2/3 and the lateral 1/3. That there is no muscular attachment, so that it will be very much prone to get a fracture at this site, because as we know, at the medial 2/3 there will be attachment of the sternocleidomastoid pectoralis major, while on the lateral 1/3 we have deltoid muscle, we have trapezius muscle insertion. So these are the various muscles which are attached to the lateral 1/3 and the medial 2/3, but there is no attachment at the junction of it. That's why we say that it is more prone to fracture at this site. The clavicle is a modified long bone. You know it really well, right? And it has two primary center of ossification, right? One primary center of ossification will move toward the medial end, and one will move toward the lateral end. Of medial end, it will move to articulate with the clavicular notch of the manubrium. So in the sternum there are three parts. We have manubrium, we have body, and we have xiphoid. So in the manubrium there will be articulation of the clavicle, medial end of the clavicle, to form the sternoclavicular joint in between the sternum and the clavicle. And this sternoclavicular joint is a saddle variety of joint. That's more important. Then we have the center of ossification that will move to the lateral end, and in the lateral end it will be articulating with the acromion process. This acromion process is present in scapula. So this shoulder blade in the acromion process will be articulating with clavicle to form which joint? As we know that in between acromion and clavicle, what is the joint? It is the acromioclavicular joint, and this is a plain variety of synovial joint. Now, as we discussed that two primary center of ossification, one will move medially, other will move laterally, and they will fuse later. So this make the junction of medial 2/3 and lateral 1/3 a potential weak site. Okay. Now There is another reason. As we know, at this site there will be a nutrient foramen. So nutrient artery will pierce that. That means this site is also having the potential weakness due to the nutrient foramen. Also, this supraclavicular nerve has having three branches. We have the medial, lateral, and intermediate. The intermediate branch of the supraclavicular nerve will pierce the clavicle. Let me explain it more clearly. The clavicular nerve is a branch of the cervical plexus which will be piercing the clavicle at the medial two-third and lateral one-third. So important thing is there are six reasons. I will mm, make it very easy for you. First, there will be curvature change. Second, there will be shape change. Third, there is no muscular attachment at this site. Fourth, it will be having the two primary center of ossification at this site so that they will fuse later and become weak. Fifth, that there is presence of nutrient foramen, so obviously it will be a weak site because the nutrient artery will pierce that. And the last, that it may be pierced by the intermediate branch of the supraclavicular nerve. I hope you will have understand that this clavicle anatomy will tell you that the fracture will occur most probably at the medial two-third and lateral one-third. Now, as we understand that the fracture of clavicle, how is it occurring? Now, what happens if there is a clavicle fracture? So, if there is fracture of clavicle, then the patient will be having the sagging of arm. It will support the arm with other hand. So why it occur? As we know, as I have already told you, that on the lateral one third there will be attachment of the deltoid and the trapezius. So it will cause the clavicle, the lateral one third of the clavicle to having downward movement, while the medial one third will having the sternocleidomastoid attachment. So it will allow the clavicle to move upward. So there will be downward movement of lateral one third of the clavicle, and medial two third will be having the upward movement. But along with that, the lateral one third also has medial rotation. Why? Because there will be attachment of the clavicle with the as we know, there are medial rotator as well. We have teres major and the pectoralis major. These all muscle are very important because it will cause the medial rotation of the clavicle, lateral one third medial rotation. So in short, in the clavicle fracture, most probably at the junction, there will be downward movement as well as medial rotation of the lateral one third of the clavicle and upward movement of the medial two-third of the clavicle. I hope I am clear. Along with that, the person will be having the sagging of arm, and it will support the arm with the other hand. Can you tell me why there is sagging of arm? As I have already told you that clavicle will not be able to transmit the force from the limb toward the axial skeleton. So the force of the limb or the weight of the limb will not be there, will not be held by the clavicle. That's why there will be sagging of arm. That's more important. Okay, so that's all I think for today. It is like I have covered the clavicle part. I have also covered the fracture of clavicle. I really want you to answer it, that why clavicle is called a modified long bone. You will have to answer. You can also write it in comment section if you can. But I hope you will have understood it well. If you have any question, feel free to ask.